A little bit about myself. My background's a little bit different from most pain doctors. Most pain doctors are anesthesiologists. I believe if anybody was on the website of the Wellness Center, it called me an anesthesiologist. I'm actually a neurologist. I trained in neurology at Brown University, did my medical school training at Temple University, and then I completed a fellowship in interventional pain management techniques at the University of North Carolina. And I've been here now in Doylestown for a few months. And I'm loving it so far. It's great. The community is wonderful, so I'm glad to be here. I was asked to speak about pain management strategies. And it's a great topic for a number of reasons, and I hope to tell people about my perspective on the field a bit. In particular, because it always intrigues me that people are always asking the question, well, what do you think about the field? What is your perspective? How do you treat patients in pain? And I'm intrigued by the question because it suggests that there's a lot of different ways to treat pain. There's a lot of different modalities for treating pain, and that couldn't be further from the truth. And I'll go over that in a little bit more detail. Hopefully through this talk, I'll enlighten some of you about how I feel about the treatment of pain. Just a couple words about our practice. I think we're probably one of the most diverse practices in the country. I work with Fox Chase Pain Management. We have three physicians in total. One's a neurosurgeon, one's an anesthesiologist, and myself, I'm a neurologist. And we practice 100% pain. Then we have 3 nurses. The nurses are probably the heart and soul of our practice. They're involved with patient education. The 3 nurses are absolutely wonderful, and our patients come to know and love them well, and they're also very involved with education. In fact, we have educational courses we provide for our patients 1 or 2 times a month. And that's, of course, just a service we offer to our patients. Then we have an athletic trainer. We have, of course, behind-the-scenes support staff as well. To see or hear any more about them, you can always visit our website at foxchasepain.com. And we have 3 different locations. Here in Doylestown, I'm on Oakland Avenue, and I'm the main one in the office here in Doylestown. We have the Pavilion in Jenkintown, off of Old York Road. And then we have a location in New Jersey also. So I'm going to discuss a number of things tonight. Here's a brief outline of what I'm going to discuss. First part is going to be focused on the definition of pain. It's important that I define pain, because without a true definition of pain, it's hard to know how to treat it. There's a lot of different types of pain. May seem that the definition of pain is one that's intuitive. We all experience pain throughout our lives, but it's actually very difficult to define pain, to define different pain types, and to truly understand the nature of pain and how it affects the individual. So I'm going to go into detail about that to some extent. We're going to discuss, of course, the bulk of this discussion is going to be treatment strategies, and there's many different strategies that we employ to treat pain. From chiropractic care to physical therapy to massage therapy, acupuncturists. All these people are, of course, experts and professionals involved in the field of pain management. The fact that there are so many people who make their profession treating pain, I think goes to show that it exemplifies the fact that pain is extremely difficult to treat. We struggle greatly with the treatment of pain, and we really use multiple modalities to treat it. In part because we don't know which modality is going to work, and we'll get more into detail with that. I'm going to discuss something that we focus on a lot, and that's procedures. I'll review a few of the procedures that we do at the surgery center. And then I'm going to discuss sort of something that's sort of novel in the field of pain management. It's the concept of neuromodulation. It's the idea that pain has its center, it has its basis in the brain, spinal cord, and nerves in the body. Recently, we have a number of innovations in which we directly affect the signals of nerves in the body, in the spinal cord mainly, also in the brain. And I'm going to discuss some ways which we are able to change those signals, the pain signals, through a process called neuromodulation. In the upcoming slides, I'm going to define pain a bit, but I want to start off with the quote. And the quote is, pain is inevitable, suffering is optional. We all have experienced pain, and it's part of survival. Without it, we probably wouldn't survive. There's actually medical conditions. One of them is called congenital insensitivity syndrome, where patients don't feel pain. As a result, they suffer recurrent injuries over and over again and severely decreased life as a result of that. We all experience pain. It's an important part of life. Unfortunately, with prolonged pain, people oftentimes have suffering also. We try our hardest to prevent this suffering, and I think we do a pretty good job at it. But suffering is one of those things that patients with chronic pain do endure. I believe that suffering truly is optional. We have the option of treating it, and we have the option of taking care of it somewhat aggressively so it doesn't get to so pain doesn't get to the stage of suffering. This is a picture by, I'm going to mispronounce this artist's name. It's Agnolio Bronzino. She's from Florence, and it was painted in the 1500s. And this picture, I think, is a great depiction of a patient who is suffering. And looking at it reminds me of a number of those qualities and emotions that my patients experience. You see a patient who's clearly in a lot of pain, probably suffering. She's distressed, I'm sure, from her pain. She's frustrated. She's probably somewhat temperamental and short with her family members because she's sick and tired of living in pain. And these are all things that I see when I look at this picture. And I think it's a poignant reminder of what a lot of my patients go through, maybe what some of you go through as well. So I thought it was a good example of that. Like I said, we have the option of treating pain before it gets to the point of suffering. To determine how to treat pain, we have to define it. There's actually a definition that's been provided by the International Association for the Study of Pain, IASP. And they describe it as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. It's sort of like a duh kind of definition. I mean, obviously, pain is potentially something that can cause damage, but it's when it leads to it's a sensory and emotional experience. So pain in itself, the sensation of pain, isn't enough. It's the emotional aspect that goes along with it that creates the true concept of pain. And there's various types of pain. We have something called nociceptive pain. This is the pain that we all experience if we have a splinter or we hit our finger with the hammer. That's called nociceptive pain. It's the pain that causes us to withdraw our hand from a noxious stimulus. And it actually serves an important purpose. By moving our hand, we're preventing further damage from occurring. So it's very important. It's a very important aspect of the pain. Now, if we don't move our hand in time, we develop inflammation. Inflammation is a fancy way of saying swelling. When inflammation occurs, we all have had it. When you get hit in the eye, it's the swelling. When you get a cut, it's the swelling that lasts for days afterwards. It also serves an adaptive purpose. It tells our bodies not to continually hit or insult that same body part. So it has an adaptive purpose. Unfortunately, the next type of pain, which is called neuropathic pain, doesn't serve an adaptive purpose. It serves no functional benefit for prolonged survival. It is a nuisance, and there's really no purpose for it. It's a pathological state. The body isn't acting like it's supposed to. So basically, it's pain in the setting of no noxious stimulus that's causing pain. And then the last type of pain, I have it under the category of other. This includes conditions for which we don't have a clear definition at this point, like fibromyalgia. We know it's a painful disorder. Clearly, it is a disorder that disables many people. We don't exactly know why it occurs at this time. There's a lot of light that's been shed on it in recent years, but it falls under this category. Migraine headaches also fall into this category because at this point we have a very unclear rationale for why migraine headaches occur. So it's sort of grouped under this category of other. I imagine once the scientists figure out what's exactly causing these disorders, we'll have other categories to place them in. So this is sort of like a classic example when we talk about pain. A person touches a hot stove and they automatically have a withdrawal reflex. It's adaptive, as I already mentioned, and it serves a purpose. That purpose is to warn the body against further damage. So it's a warning system. It's an alarm system that the body has. And as I said, it is an adaptive type of process. For many years, we always believed that pain has an underlying cause, and doctors for centuries have sought to find that underlying cause. Chronic pain doesn't always have an underlying cause. That is, maybe a person has a herniated disc, maybe they have sciatica that goes on to persist. Why it persists is very challenging for us to figure out. About 2% of the patients who have back pain will go on to have chronic back pain. Well, at that point, it's not necessarily the herniated disc in their back that's causing the problem. It may be, but not necessarily. What we now know is that there are significant changes that occur in the brain and the spinal cord and the nerves out in the periphery, which actually drive the process of pain. So in a way, pain is a pathological state. Pain is the disease in many respects. And without addressing exactly what is causing it, that is the changes in the nervous system, oftentimes we fail in truly treating pain. Again, I'm going to go over a couple examples of how we treat this type of chronic pain in a little while. But this was actually based on a true study, these two pictures. In the top, this is based on what we call functional MRI imaging. It's basically a type of MRI where certain areas of the brain light up. Those areas that are most active light up. What researchers found when putting normal patients, healthy patients, in the scanner is that their brain is in equilibrium. So the different parts of the brain are just as active as one another. On the other hand, the chronic pain patients, there's a couple different areas. One is in the frontal lobe, the other is in what we call the occipital lobe and temporal lobe. There's a couple areas that light up, that are more active. And in a way, that's what's driving the pain, the hyperactivity of various parts of the brain in some of these patients. Just to go over a couple pain statistics, 50 million Americans live with chronic pain. Headaches are actually the most common type. This is followed by low back pain. The price of pain, this is both indirect, that is loss of work and loss of function, plus the medical costs are over $100 billion a year. So it's very expensive, obviously. As I mentioned, 2% of those people who develop back pain will go on to have chronic back pain, incapacitating pain with no clear underlying cause that just persists. It's not just back pain, by the way. It's a lot of other pain conditions can do the same thing. So basically, any type of pain, we'll go over a number of them in a short while, can produce ongoing pain. And there's common pain syndromes. So the most common types, as I mentioned, are the back pain, and you can see that there's a number of different types of causes of back pain. And headaches are probably the most common cause of pain, and it's, I think, the most common reason for work absenteeism is headaches, actually. Cancer pain, post-surgical pain, certain type of pain entity called complex regional pain syndrome, which we see a lot in our practice. Pelvic pain, facial pain, diabetic pain, nerve pain, myofascial pain, and of course many, many, many more. Any body part can develop pain. This is a list of some of the most common things we treat, but by all means it's a short list. We treat many other conditions.